So I see a black in there.
There we go.
Good afternoon and welcome to the Public Health and Safety meeting for June 24th at 3 o'clock. We'll start off by introducing ourselves.
Karen Hiller, District 1.
Aaron Mays, District 7.
Welcome to everybody. I'm Councilwoman Ortiz, District 3, and also the chair. I wanted to approve the minutes from March the 29th. Didn't know if you had a chance to look at them.
Councilman Mays wasn't there, so I'll move to approve.
I was thinking
I
the
think
same
it's up
thing.
to us.
So move. All those in favor, raise your right hand. Okay, passed unanimously. Thank you. Okay, next we're going to have our staff presentation, and I just wanted to say a few things before we get started. We do have two new council members on the committee, and so some of this will be some overview. A lot of it will be overview. If you could just be patient, I want to make sure that they get caught up to speed so that we all know where we're going and figure out where we've been. Okay, we'll start off with staff presentation and follow-up. Corey, you want to go first? You got some numbers for me? Good numbers?
Good numbers.
Good numbers.
Okay, so just a little overview of the Housing First. I think it's in your packet that Legal made for you. But Housing First is exactly what it sounds like. It's us doing a rent subsidy for people without preconditions of them required to be into services of any kind. So we piloted this little project as part of our Shelter Plus Care program. So we kind of have like two Shelter Plus Cares, really. One for that's not Housing First, and then Dr. Burton's folks who are coming from the Housing First model. We started that back in March, and we've housed a lot of people. So I'll give you some numbers of where we're at. So we gave vouchers to 46 people, and that includes a few kids. 37 of those got housed, so that's 80% of the vouchers that we gave out. We were able to house people. So that totaled 33 households that received vouchers. 25 of those were housed, so roughly 76% of the households were filled. Of the 25 that were housed, this is new data, 2 were evicted, so we have 23 out of 25 who are still stably housed, and that's since March. So 92% of the people that we housed are still stably housed going back to March. So considering we're working with a very definitely chronically homeless individuals, that number is pretty good, and we're pretty pleased with it. Of those that were housed, even though we are using the Housing First model, Vallejo services and Dr. Burton's services were offered to all of these individuals in this pilot project. And many of those, and Dr. Burton probably has a specific number, many of those have chose to get into services with either Vallejo or, in fact, Dr. Burton. So we're really thrilled with that number and be happy to keep reporting back so you can see how those numbers keep looking. So right now, with that big group of people that we just added to our Shelter Plus Care rent roll, we also added 14 of Community Actions individuals onto the program. So we have a wait list for Shelter Plus Care at the current moment, but we expect maybe in a month or two that wait list will go down, and we can maybe do another round of these individuals. So that's what we have. Any questions?
Corey, are we out of money? Is that why we have a wait list? Why do we have a wait list?
Yeah, so we're funded for 184 units per month. We actually, because of rent savings, cost savings, are able to house about 230 to 240 households on a given month. So we are at full capacity, so we can only spend so much money per month to level that out throughout the year to make sure we have enough money by the end of the year. So we are at that cap right now, and so we just have to wait for some people to leave the program in one way or another, then we can bring more people on.
Okay. All right. Yes, Councilwoman Hill.
If I could get you to help me, my pen ran out of ink. About the time you were skipping from housing 33 households to having 23 of 25 still housed,
Yes.
and I didn't make the gap.
So we, 33 households received a voucher, 25 were housed.
Okay, we started with 43 people, or 46
46,
that were approved,
46
Right.
people.
and then 37 housed, which was 33 households.
Yes.
That-
No,
I'm sorry, that's where I got lost.
46 people, 33 households. Those two go together.
Okay,
And then 37 were housed, 37 people were housed, 25 households. Maybe I should have worded it like that.
that helps. Well, again, I got distracted right when you were going through those numbers.
Lots of numbers, yeah.
And given that population, that number seems really high, although many of them have not been housed very long, right? I'm looking at you and Russell.
Yeah. We did this in March, so many of the people got housed in late March, early April. A few here more recently, but most of them late March, early April. And we have received, we had 2 that were evicted, of course, but other than that, we've received no complaints on any of the individuals that are currently housed.
That's phenomenal.
Yeah, we're
is.
we're
It's
excited
really
about it.
great.
Dr. Burton is a substantial partner and key to making it all happen, so,
Well, and this is also a time of year when it's easier to be outside than
yes.
the other end of the year, so.
Yeah.
Good report. Any
Okay.
more questions for Corey?
I have one real
Sure.
quick. So the folks that receive the voucher but don't necessarily get housed, are they just not able to find a place or unwilling to follow through or?
So Dr. Burton might know the specifics of each of those individuals, but essentially they have 90 days to find housing. If they don't find housing in 90 days, then we give a voucher to the next person in line.
Okay.
So probably they just weren't ready to be housed. We find our Shelter Plus Care people, especially people looking for one bedroom, don't have problems in Topeka finding housing, even with poor credit history, rental history, criminal history. We still have a lot of landlords that work with Shelter Plus Care and are willing to provide people with second, third chances.
Okay,
Yeah.
thanks.
You bet.
Any more questions? Thank you. And Corey, our next meeting, I want more numbers if
numbers.
you can.
You bet.
Thank you. Appreciate it. Okay, next, I'm gonna ask the doctor if you want to come up and report anything? Sure. I'm trying to think of your name here. I'm losing it. Dr. Russell,
So I want to speak to, I guess, a couple of things. The numbers of folks, the percentage rate of folks remaining housed at 90%, I think that's a pretty neat number. If you would have, made me guess, I would have said that's not going to happen. So I think that's really good, and it does speak well to the Housing First model. I mean, substance use is down among the folks. Substance use treatment is up. Folks are talking about going into treatment. They're going into mental health treatment. We got folks that have physical disabilities that are getting lined up to have back surgery. Folks are working on. We have actually somebody's employed, a tax-paying citizen. They got a full-time job and they're working. So Housing First, does work, and the research says it works, and it works here in Topeka. Amazingly enough, we're kind of like the rest of the world in a lot of ways. I just want to report that what we did with the 43 folks was overwhelmed the system. Vallejo had a difficult time doing intakes. They do intakes first come, first serve, and they do 5 a day, and they do that like 4 days a week, and that's what their system can handle. Well, we broke that system when we brought those 43 people in. I mean, we were struggling for case management, and Clem was overwhelmed with his city IDs, and this is probably not the way to do this in this kind of mass form, but in a more structured arrangement where we could, as it stands right now, doing what I do with everybody else, we can probably move, if we had the vouchers, we could probably move a person a week into housing. And that's without any supports from anybody else. So, you know, I mean, it would just be, you know, me doing that. So we don't, you know, and I can't bill for case management, so that's a whole state issue. The case management billing code is locked up and it's only available to community mental health centers. So it provides, if I could bill for case management, I could fund this operation just on case management billing alone. But otherwise, and I could hire additional people to help, but otherwise I'm kind of stuck. And then let's see, one other thing I wanted to mention, I think. Yeah. So we had the number of people down on the river reduced to 3. The most recent head count that Misty from the community has provided, and that was confirmed by Daniel as well, is that it's about 70 folks that are down on the river at this point. So there's a lot of folks on the river. There's a whole lot of need for vouchers. We don't have near enough vouchers to be able to handle this. So then to speak to, if I may, to keeping this ordinance open, and these folks want to come off the street. Our community doesn't have the power to do that at the moment, but yet we continue to threaten them with this ordinance. Again, it's disturbing. Some of the most powerful people in our community are holding this over the head of some of the least powerful people in our community. And it's really bothersome, especially when it's our responsibility to solve this problem, and we can't solve it fast enough at the moment. Right. So it seems unfair, and it seems unfair to, again, some of the poorest people in our community.
Dr. Burton, if I may, with all due respect, this has started last year. And I told you I wasn't going to move fast on it, and I haven't. And I appreciate your work on this that has made this such a success, along with staff's. And I think that's why we're looking at everything across the board. It's not a threat over their head. It's an ordinance that was brought to us. But I need to get these guys up to speed and then see whether we want to drop it or what we want to do. And I think we're doing some very good work that started from day one, and that says volumes. That really says a lot. I was talking to a couple of different people because I did hear that I didn't know we were down to 3. I was heard down to 10. But that's okay. But I heard we got a big flood, a mass of people in. We don't know if they're from Lawrence. We don't know if they're from Kansas City. Because when you talk to these people, we have a good support system for the homeless here, the rescue mission and different entities, and it's no secret. I've met people, been at the spray park, and I've met people that have said, oh, I'm from Lawrence, I'm trying to get over there. You know, I heard they give you this, they give you that, you know. So I don't know where this big mass, and I don't know if Officer Clan or Sergeant Clan knows, if he can, you know, give light to that or whatever. But again, I appreciate all the work that you have done. We're not rushing this. We're trying to figure it out, just like you, and we appreciate all of your help. And he's a volunteer. He's come on board and said, I will, and that speaks volumes, because a lot of people say, I will, and that's all they say.
Yeah, again, I do appreciate that. I mean, the ordinance is not an innocuous thing. I mean, it is a real entity for the people on the street. Mm-hmm. You know, it is again, the idea that all of your everything you own is going to be impounded by Sergeant Clem. I certainly hope Sergeant Clem's not going to have to do the impounding. But everything they own, chainsaws, wheelbarrows, clothes, everything would be impounded by Sergeant Clem, and they would go to county for 30 days. I don't know exactly how much money that cost, about $80 a day, but that's a lot of money. And then they're going to have a fine, which they can't pay off. And then they're going to get released, and they're going to go over to Sergeant Clem, and they're going to pick up their stuff and do exactly what with it?
No, we're trying to figure that out. We want to help.
So that, yeah, but that ordinance, that just then makes them even more poor than they were before it started. Mm-hmm. So it's really not constructive in solving the problem. I wish the city council could find a way to put its energies into solving the problem instead of keeping that ordinance alive. I mean, the group can still meet and we can still, plan all of this without having to have that ordinance hanging over the heads of folks. Again, it's unnerving to know that Sergeant Clem's already got the place to store the stuff. It's unnerving that people could lose everything they have,
Your point is well taken.
all right, I appreciate that. Thank you very much. I appreciate your time.
I think the committee has heard you.
Yeah.
Karen?
If I can ask a question. One of the things we are looking at, of course, is taking this time to see how things work and look at what long-term solutions are there. And not all of them necessarily. There are many things that regulate the circumstances that we're talking about. And you mentioned the billable units. Can you talk to us a little bit about whether is there something we can do with the state or otherwise to see about loosening up that?
Well, so I understand, and I've really not done much research in this, but as I understand it, Missouri has unlocked, jailbroken the case management billing code, and they've allowed regular mental health providers to bill for case management. And it seems to have worked well from what I understand, but again, I haven't read all that much about it.
Is it federal?
That's a state issue. The billing code is a state issue, whether right now only community mental health centers can bill for case management. So if that code were broken free and allowed regular practitioners like me to bill for case management, I've got lots of people down there that here's the way this works. A lot of folks, if we had a Medicaid state, this would be no problem at all, because folks would have Medicaid. But right now, the way this works is you identify folks, then you bring them off the street, you sign them up, they put in an application for disability. Once you put in a disability application, then your Medicaid application generally is accepted. You generally get some type of Medicaid. You can back bill for 90 days with that. So if you can get somebody in and you can get a disability application written, a SOAR application technically is what they're called, and send that in, then you can get Medicaid and you can back bill for your services. Well, all I can back bill for is therapy services. I can't back bill for case management, and I can't take people off the street without case management, because every person I take off the street ends up being on my caseload is case management, and I already run a business where I provide therapy to folks. So it's overwhelming for me. So I can bring people off the streets, but there's no support to get into case management unless they want services from Vallejo. Vallejo has been very kind to offer their services, but not everybody wants to take services from Vallejo. And so then we're at a loss as to what to do.
Second question. So is anyone working on that issue to your knowledge?
Not that I'm aware of, no. I've spoken to Misty at the state about it, but as far as I know, I haven't looked to see Annie Kiefer. I mentioned it to Annie at the state, but I haven't gone down and spoke with her or anything, because the session's over right now anyways. But yeah, that's certainly something that could be addressed. I mean, if we made it a Medicaid state, that would solve the problem too.
Understood. Thank you.
Yeah, okay, you betcha.
Any more questions? Okay, thank you.
You betcha.
Okay, next we'll hear from Sergeant Clem.
One more thing, I'm sorry. Misty she's from the community down there. She could probably tell you the characteristics of the folks down there. She's the one that's responsible for the head count of 70.
Okay. Can I have her go first?
Sure.
Misty?
How are you guys today?
Good.
I'm not sure how this goes, but I am one of the individuals down there who stay in one of the campsites there. I was asked by another individual down there to do a head count from the Kansas Bridge to the Sardu Bridge, and there are 70 of us there. Out of those 70 of us, 10 of us have Medicaid, Social Security, or Medicare. And that number is really low because people are afraid to go to certain places because of the way that we're looked at. They choose to be down on the river because it's close to the mission, where you get your 3 meals a day. You get a shower if you want. It makes it convenient. So If I had someplace else to go right now, I would. I have a part-time job where I clean houses and that kind of stuff. I help as many people down there as I can. So I would like to see that they be allowed, to camp there, to still be respectful. There was a trash issue when I first got there, and I'd say probably 70% of the trash has been picked up and hauled out of there where it's supposed to be. There's still some work to be done, but we've all been pitching in and taking care of it, so.
Thank you for your testimony, Misty. What do you see the problem as with those 70 people besides?
Well, right now, I think the weather is nice, and that's why so many people show up down there. They don't have to find a place to go, There's a bunch of paperwork. Some of them don't have IDs, some of them.
But are they familiar with the new ID process?
And they said at first it was okay because you got your ID right away, but now, because of the lines there, it's taking a little while, a little longer. So people are a little less apprehensive about going down and standing in line all day. But some people have legal issues, and so I think for the most part, though, it's just the convenience. The people that I've talked to, they like not, having to. We get water at the mission. We get food at the mission. We can shower at the mission. Most of the time, if we need a service, an NA meeting or an AA meeting, they can tell us where to go. And a lot of people down there, like Dr. Russell said, they are talking about substance abuse treatment and just having a place to go.
Dr. Russell talked about we went from 3 to 70. Where did all those people come from?
There's a few people that are from out of town. Like you said, a couple from Lawrence. I'm from out of state. My boyfriend's from out of state. But most of the people that are down there are right here in Topeka. They have nowhere else to go. And like I said, convenience puts them close to the mission.
Okay. Karen, did you have a question?
I was going to follow up on that one. That's
Okay.
fine. Question?
Good.
Okay. Thank you for coming down today. And hopefully you will talk to them. And Corey, do they have your contact information as well? Okay. Okay. Thank you. Okay. Sergeant Clam, and I'm to Karen and Councilman Mays. He put together this, I don't know if you guys have seen this. This wonderful ID. This is the ID
yeah,
that
I've seen
we're
it.
talking about. I'll show it to you if you want to look at it.
Yeah, I've seen it before.
Okay.
I'll look again.
All right. You got the floor.
Yeah, and I can give you a quick rundown on the IDs.
Sure.
So it was originally designed for our unsheltered population. It's not it's exclusive to them, so anybody who needs an ID can come out and fill out an application. But it originally was designed for our unsheltered so we could get them some type of ID. We've since partnered with the Department of Revenue, and we've streamlined the process of getting a state ID if you get one of our city IDs. One of the issues is if you go in as an individual to get a state ID, you have to have basically ID to get ID. You have to have some type of documentation to prove your identity. We've kind of flipped that around to where we've proven your identity. And so as long as you have one of our cards, they're willing to give you a temporary Kansas ID card for 1 year, and that allows you to get your birth certificate and social security card and things of that nature. And the way we do that is we use our police databases to confirm identity off of an application that the individuals fill out. So she mentioned that the wait is a little bit to get the IDs. It's true. We're up to about 260, give or take, printed city IDs. I didn't count how many stacks of applications are sitting there, but probably 70 or 80, something along those lines. So the turnaround time is, it was a week. It's turned into a month if we have no issues. What makes it a little bit longer, so she talked about some of the individuals from out of state, for example. I don't have access to, let's say, Las Vegas. I don't have access to their Department of Motor Vehicles or their driver's license bureau or their jails or anything like that. So what I usually use is a book and profile or an old driver's license to confirm your identity. I don't have access to any of that stuff out of our jurisdiction, so that slows things down if you are from out of state. So out of state or even just Lawrence. Like if Lawrence isn't willing to participate and provide that information, it's very difficult to confirm their identity. And if we can't confirm it, they do not get an ID card. It's really just that simple. So we're about 260 city IDs. We're around 30, 35 state IDs, if I recall correctly, on that conversion. Just trying to get people in there from the camps is a little challenging, but it's something we're working on. We got bus passes and things of that nature. I know I got 2 signed up for this Thursday. We're going to get some more state IDs. So we have that happening. We also have the outreach vehicle that I presented on, a month ago, give or take, at the city council meeting. We're going to start using that in a temporary basis, probably early next month. It's still in the shop, still getting a couple things worked on. The big issue is that we turned it from an emergency vehicle to a non-emergency vehicle, and so you have to change out a bunch of stuff to conform with the law. And so we'll start rolling that out on minor issues probably next month, and then in 2 months, I think we'll be good to go to start rolling it out once a week. What the general plan is. So overall, kind of what she's talking about, the camps are looking better down there. It is very crowded down by the river behind the mission. However, it is looking much nicer. They are taking care of their camps and the grounds around. Trash is being picked up and disposed in proper containers, things of that nature. So I'm happy to see that. We have also just more homelessness, not just behind the rescue mission, but like the Shunga Trail, the Landon Trail. Anywhere that you have a big, giant cluster of trees, there's a good chance there's someone in them right now. So just food for thought.
What can we do to help you with IDs, or is there anything we can do? I know she said they don't like to stand in line.
So right now what I have is our VIPs, our volunteers in patrol, they man a booth every Thursday from 3 to 6 p.m. And at that time you can come fill out the application if you've never done that, or pick up your ID. And so the big issue is the confirmation. I have, I believe, 5 officers helping me with this as far as going through applications and confirming identities. It just, like I said, it just takes a little while. If there's 0 issues whatsoever, it's about 20 minutes per person from time I look at their application and print off a card. So, I mean, you're only talking 3 an hour in general. So it just takes time, unfortunately. But we have a large number of applications even just waiting. But I think we probably have, 60 ID cards waiting to be picked up at the LEC right now from individuals. So
You said Thursday from what time?
3 to 6 p.m. at the Law Enforcement Center.
Are we picking anybody up and bringing them to the law enforcement center? Are we doing anything like that?
We are not. We just don't have the resources.
We do, I do, when
Okay.
Friday, folks have come down Thursday, last few weeks, it hasn't happened, yes. Or they get bus passes.
Okay. Okay.
So,
Okay.
any other questions I can answer for you guys?
No. Did I give you any more homework?
I don't believe so. Yes, ma'am.
You said it's pretty crowded. At 6, if people haven't been served, do you all stay till they're all served, or do they have to come back?
I don't understand the question. I'm sorry.
If you've not been able to process everybody who was in line by 6 o'clock,
Oh,
what
yeah, we're not
happens?
gonna, we won't turn them away. They'll be allowed to fill out their applications or,
Okay,
Yeah, if there's a line, we don't say, hey, it's 6 o'clock, you all gotta walk.
just checking.
Yeah, no, everybody gets a chance to fill out their applications. And we'll also take a current photograph of you at that time too. But honestly, usually there's a line starting around 2:30 in the afternoon. But yeah, they stay very busy. But yeah, we don't turn anybody away.
Just checking. Thank you.
Okay. I know me and you had talked last week, maybe 2 weeks ago, and you had some news to share. Yes or no?
I sent an email. Is that what you're referring to?
I don't know.
I sent an email today. That's probably what you're referring to if you want to check your emails.
Okay. Do you have anything else for us?
I don't think so.
You guys, you're still, I know that you said that, I forgot who it was. Oh, no, I know. That there's 70. Are you concerned with the number again?
Oh, absolutely. I mean, it's crowded back behind. No, it's not just behind the mission. The Shunga Trail is picked up. The Landon Trail is picked up. We have a lot of just unsheltered out in the community right now. And sure, it worries me. I mean, you have that many people in a pretty small geographical area. You're bound to have some issues. You're about to have, personalities that just don't mix. things like that. Everybody's fighting for the same resources, so it's a little alarming, but
Sergeant, did you get, I thought we were looking at, you were gonna get one more officer. Did we get one more officer?
not as of yet. So I talked with command actually just today. We started an academy class and they look to graduate, if I recall correctly, in October. So honestly, later in the year or early next year maybe. Again, it's just a manpower issue. But with the current academy class, the current academy class is 16. So if they all graduate in October, by the time they're hitting FTO or out of FTO, hopefully by that point, we'll have our numbers back up to where we can backfill some of the specialty units such as mine, and we can hopefully have another officer then.
Okay, all right. You have anything else you want to add?
Nope, I think we're good to go.
Okay.
Thank you.
Any more questions?
I have a question.
Sure. Sergeant Clam?
So we've heard a couple of people have mentioned people coming over from Lawrence. Is that a chronic problem?
Yes.
And why is that?
I can only speculate. We do have a lot of resources. We have a lot of services available to our unsheltered and to our mental ill folks. So I believe it's not just Lawrence. I do think other jurisdictions help individuals come to Topeka because of the services that we have available here that they might not have in their hometown. So I do think that's one of the issues. Our rescue mission is very well known for doing really good things, and so I think that's part of it. I think our housing first model has also gotten out, and so I think that's part of it as well. And then, like I say, with mental health, Vallejo's done a fantastic job. So yeah, Lawrence, some of our eastern areas, we frequently run into individuals from those counties or cities.
Word of mouth. It's good.
Yeah, so we've become a destination then?
Sort of. Yeah.
That's my speculation. I mean, I can't prove it, but I'm wondering. Especially like what Dr. Burns said, going from 3 to nearly 70. That's a big boom. That there's more there now than there was at this time last year, and so I can only speculate that it's because of the things that we've been doing. And so yeah, kind of word of mouth. Hey, if we get down there, we can hopefully get this also. So, which is good and bad. I mean, it's good that we have these services going and helping people. It's bad because there's 70 people back there right now. But
Yeah. Thank you.
Thank you. Keep up the good work.
If I could speak to that, I'm going on vacation 2 weeks, but for 2 weeks, but when I get back, I intend to go down and do some qualitative research down there and find out exactly what's going on, what's drawing people down there, because I'm super curious about that as well.
What? And I've heard of the practice of what they call greyhounding, right? Where cities give them a one-way Greyhound ticket and send them somewhere else. And I'm kind of wondering if that's what's going on.
We'll see if we can't count up and get ahead count how many people.
For our viewing audiences, Dr. Burton said that he's going to be on vacation for a couple weeks, and then he will go down and kind of talk to some of the people to see where they come from and why they're here, just to get a view. Thank you. Okay, let's do this. I want to talk a little bit about legally. Luther, can you kind of update them on your slideshow?
sure.
So let's talk about the ordinance a little bit. Is it gonna be behind me? For both? Oh, okay. Like, oh.
Kind of small in the picture.
All right. Okay, what I've got is kind of a summary of presentations that I've done before, and I've combined them and updated it a little bit. Back when we began this discussion about the ordinance, this was kind of some of the things we were concerned about, was the negative impacts of all the camping and the private or personal belongings and stuff being stored on property. Obstructing right-of-ways, just the use of the public property, public urination and defecation, infestation, litter, pollution, damage to property and infrastructure, different complaints from businesses, and also some of the crime that goes with that type of activity. Now, these pictures, like I said, it was a little over a year ago we started this process. Some of these pictures were taken back at that point in time. Obviously, this one is the north end of the Kansas Avenue Bridge. That situation's a little different because we had a fire under that bridge. But if you see just a series of photographs we go through here, the point of these pictures is to demonstrate one of the problems that this issue brings up. This is outside of the rescue mission. It's actually taken from a drone along the river. This particular photograph was along 470 out near Wanamaker. It was just an undeveloped private lot that had trees on it. This is between the river and I-70 going west along railroad property. This was a camp that was on the river. This was in undeveloped commercial property out by Lowe's and the hotel out there. That's actually a tent that the individual was using. This was from just a little corner, really unnoticeable little piece of land on Wanamaker, kind of tucked in behind some businesses and between the street. You wouldn't even really know it was there unless you were specifically looking for it. But there was some trees, and this individual had converted a box into a shelter. This is more pictures from on the river. This was a camp that had been abandoned. This was actually a campsite that code enforcement cleaned up. Now, some of these pictures are dated back to when we began this program, or began this discussion. This is a fairly current picture. This picture was taken in April, and it's under the I-70 bridge, pretty close to downtown here. There's several individuals underneath that bridge that are camping. And after the fire on the Kansas Avenue Bridge, we put up no trespassing signs. And for the north end of the bridge, this since then has popped up on the south side of the Kansas Avenue Bridge. The camp has moved over there. This is not too far from where the fire was not too long ago that burned that building. So the pictures are just kind of describing the problem. This ordinance is not intended to replace any of the services that we've been talking about or to suggest that those services are not working. It's not a replacement for a housing first model or for a homeless outreach model. All of those things actually need to happen in order for this ordinance to work. It's like pieces of a puzzle. This is just a different piece, what this ordinance does. You have individuals that come to this community because we have a lot of services to offer. And the reality is some of those individuals will be content to accept the services and never move beyond public camping on property and leaving these kinds of things behind. This is what this ordinance is intended to address, is for those people that, for whatever reason, refuse to accept services and stay in this type of environment. So the ordinance begins with a definition of camping and what we're talking about. On public property or private property without written permission of the owner. It also includes storing personal property. And what it does not include is those kinds of, it's kind of a common sense thing, but it does not include recreational activities like if somebody is just going out for, an event or to camp with their family or something. It's not intended for that. This is intended to cover situations where somebody is using public or private property without permission as a substitute for living accommodations. The property that is covered as public property is not simply that the property that the city owns. It also includes property that the city manages or maintains. So all of the right-of-ways under the bridges and public parks and all of those things the city would have responsible for maintenance or managing. The ordinance would cover those as well. The actual piece of this, the unlawful part of it, camping on public property, camping on private property without the written consent of the owner. Now, it's also important to understand at this point what we're doing here. For this ordinance to be constitutional, we have to make a distinction between what a person's ability to do is versus their willingness to do. And we have all of these services and programs and different things available to people. Some of those people will refuse and remain where they are. That's what this ordinance is intended to address, is the refusal to comply, not the people that are unwilling to comply. There's a section of the ordinance that makes certain requirements before any enforcement can happen. This is a constitutional piece. It's a necessary piece of this ordinance. In order for this ordinance to have a chance of withstanding a court challenge, you would have to include something like this. And I'll get to where this comes from in just a minute. But the first thing is the person has to be warned, contacted by law enforcement, given an opportunity to leave, remove their personal property. This is where a lot of the outreach efforts is going to come into play with the homeless outreach team and stuff like this. They also need to inquire if the person is in need of assistance, whether it's medical or social services. We have to offer those services to them. And then the third thing is they have to decline. If they accept the services and then go on, there's never going to be any enforcement of this ordinance. That's the whole point, is we've identified them, we've offered them the services and educated them on what they are, and if they accept them and move on, then there's no enforcement. If they decline to accept the services, then what we have to look at is there another option available for them? Because we can't criminalize the unwillingness to comply or the inability to comply. The person has to have available to them an alternative to sleeping in public, whether that's a shelter or a voucher or a place where camping is permitted, whatever option it is, it has to be some alternative that is available to the person. It's only if those three conditions are satisfied that this ordinance then becomes a possible for an enforcement action by the police. The property removal sections, This is also a constitutional protection. We can't just simply go out and clean up their camps and throw their stuff in the trash. That's not constitutional. We can't do that. We wouldn't do that. What this ordinance is talking about is if it gets to the point where it has to have an enforcement, that the person has been contacted and refused all of our offers of service, and there's an alternative available, and they still refuse, then they can be given a 24-hour notice that they either have to remove their property or it could be impounded by the city. Now, if it's impounded, it has to be stored. We're not simply going to throw it away. It has to be stored for a period of time. And there are times when the 24-hour, there's a limited times when the 24-hour notice would not be necessary. If it's stored within 10 feet of an entrance, or like a park with a designated closing time or something like that, or if it's a immediate threat. Some of these camps are infested with pests like lice or mites or bed bugs or whatever it is, but if there's some type of public health and safety threat, then the property could be immediately disposed of. But absent that, the property would be stored for a period of time to allow the person to reclaim it. We have to give that person notice of that. We can either give it to them in person, or we would post it conspicuously at the site of where the property is. After the 24 hours is expired, if the property is still there, then we would remove the items of property, and that's where we've already made some arrangements to accomplish this. The police department has purchased a Connex container, storing it at the impound lot. If we had to impound somebody's property, it would be taken there, it would be labeled and identified, and the person would be given a notice on how to reclaim their property. The city will hold that property for up to 90 days to give the person every opportunity to reclaim it. If they didn't reclaim it after 90 days, then only then would the city discard the property as abandoned. Now, the penalty piece of this, just like any other ordinance the city passes, this would be a misdemeanor. At the very end of this whole process, there is a criminal penalty attached to it. Now, this is some of the background on why this ordinance is written the way it is. There are certain necessary pieces to this ordinance that have to be there in order for it to be constitutional. This is kind of beginning with just some information about the scope of the problem. Here in Topeka, this was our point in time count. I updated it to 2019 figures. Back in January, we said in our point in time count that we had 66, my math is right, that were unsheltered. You just heard that we've got upwards of 70 now on just the river alone. So this number is off. I don't know that we can tell you exactly how many unsheltered people we have right now today in Topeka, but it's a lot. It's a complex problem. As I said, this ordinance is not a one-stop solution. None of these programs are. They have to work together. You need all of these programs working together in order for this ordinance to be enforceable constitutionally. So you have multiple departments, multiple social service agencies, advocacy groups, neighborhoods, businesses, community concerns. I understand that this causes some fear and some concern. Municipal code limitations. When the complaints about a large camp, the reality is there's very little we can do about it. It's not against the law right now to do many of these things that is shown in those pictures. We also have a lot of resources. The wide availability of the resources may even attract people to come from other communities to come here. Because they can camp and they advantage of all these resources, and they may or may not ever move into housing. So again, I repeated this slide on purpose. It's not a mistake. We have to make sure that we distinguish the ability to comply versus the willingness to comply. Criminalizing somebody who is unable to comply is unconstitutional. It's only after they've been offered services, talked to, tried to give them assistance that is immediately available, and they refuse it. That is what the situation where an ordinance like this is able to be enforced. There's a lot of discussions about different court cases around the country saying, camping ban struck down. Most of those are because cities are attempting to ban camping outright without the underlying things, necessary parts to an ordinance that have to be there. Some of the things that the court uses to analyze a camping ban, the Eighth Amendment on cruel and unusual punishment, and also a constitutional fundamental right to travel. Both of those are implicated whenever you start looking at banning camping on public property. The language in quotes here is from a kind of a landmark class action lawsuit that happened in Miami, Florida, called Pottinger versus City of Miami. It was litigation that went on for many years about the way the City of Miami was dealing with its unsheltered population. And the result of that was a settlement agreement that laid out many of the rules that this ordinance that you have before you has been patterned after. We call them the Pottinger Protocols. The idea behind the Eighth Amendment, cruel and unusual punishment, is it's uncontroversial that punishing conduct that is universal, unavoidable consequence of being human violates the Eighth Amendment. A person literally has nowhere else to go than enforcement of an anti-camping ordinance against that person criminalizes them for being homeless. That's not what we're doing. That's absolutely not what this ordinance is about. This was part of the problem in a lot of these cases that are being overturned by the court, is they're trying to do exactly this. This ordinance is avoiding that by having services in place that have to be offered and refused by the person before enforcement ever becomes possible. The Pottinger Protocols, part of what they did, this was the agreement between the class action plaintiffs and the City of Miami, was meant to apply to the government's interaction with homeless and their personal property. Establish some rules on how the government is able to deal with that. Began by defining what exactly a homeless person is, a person that lacks a fixed, regular, and adequate nighttime residence, and has a primary residence that is in either a public or private shelter, a place of institutionalization, or a public or private place that's not designated as a sleeping accommodation for human beings. They're sleeping out in the open, whether it's on the street, a sidewalk, riverbank, or a park. The protocols require that before the government can take any enforcement action, that they have to document their outreach efforts to get that person into a shelter, get them other social services, and they have to document the person's refusal of it through what they call a field information card, but it would simply be like an incident report or something like that by one of our police officers. Life-sustaining conduct misdemeanors, that's what this ordinance is talking about. Before enforcement can be taken against somebody for sheltering in public, those types of services that I've been talking about have to have been offered and available to the person. The shelter definition in the protocols, at least 24 hours a day availability. It has to have a bed or a mat, no cost to the person within the city. We can't establish a homeless, shelter way beyond what's convenient for people to use. Some communities tried that. They put their homeless shelter way outside the city limits and really tried to isolate the people. That's not allowed either. It has to be reasonably related to where your services are and where the people are. And then there also can't be any mandatory religious or therapeutic programming or any type of services like that that are mandated by the shelter that they have to accept in order to stay there. The shelter has to be available to the person. A police officer making contact with a homeless person at a camp, they have to be able to immediately offer them a bed at a shelter before enforcement is ever possible. Now, with all of the discussions we've been through, this is really where we're stuck, is when it comes to our shelter option. We have the rescue mission, but they don't fit all of those categories that's required under the protocols. We need an option for an immediately available shelter bed if we're going to have an enforcement piece to this. So, available shelter. If there's no available shelter, then there's no enforcement. If there's available shelter and the person accepts it, there's no enforcement. They go on their way and they go to the shelter. And we hook them up with services and do what we can for them. It's only after we go through all of that, there's an available shelter, there's services available, and the person refuses to accept it. Then the enforcement under the ordinance becomes possible. In the 7th protocol, the person is arrested, the police must secure their property. That's where the language in our ordinance, where it came from, was this class action suit out of Pottinger versus City of Miami. Finally, specialized training for law enforcement. This case recognized that dealing with the issues that the unsheltered have is a little different than the ordinary type of police work that law enforcement does. So this is kind of the origin of the homeless outreach team. It's coming out of this case that officers need specialized training, and they need to be paired with other social service professionals kind of as a team, and they go out and they make contact with these individuals. What Pottinger does not require, it doesn't do anything to limit the police from making a felony or misdemeanor arrest for other types of crimes. Littering, drug possession, anything, warrants, and all of those things are still available to law enforcement. What Pottinger is only talking about is the idea of being able to take enforcement against somebody for using public property as a residence and establishing these camps and leaving personal property all over the place. Pottinger also does not say how many shelter beds you have to have. It just says you have to have an available bed. You don't have to have a shelter that has one bed available 24 hours a day, every day of the year for every homeless person you have. That's not what it's saying. It's just saying before you can enforce it, there has to be an alternative place for that person to sleep. This slide was from the United States Federal Government Interagency Council on Homelessness. One of their recommendations was collaboration between law enforcement, behavioral health, and social service providers. We've kind of already started this. We have already started this with our homeless outreach team, having a law enforcement officer embedded with those other individuals that go out to the camps and make contact with the people. The idea behind this is this collaboration between law enforcement and social service providers is you are diverting people out of the criminal justice system. This ordinance is not about arresting people or prosecuting people. What it is about is educating and encouraging people to accept the services we already have. And if they don't accept them and they won't move on, And finally, the third piece is the enforcement. This federal government report also, again, it recommended the same thing, cross-training of police officers and service providers, information sharing, specially trained officers to work with behavioral health professionals. This is all part of your homeless outreach team that is already in place. That's what a homeless outreach team program looks like. Outreach efforts, diversion, encouraging those, not diversion in the formal sense like you would think in a criminal complaint, but diversion means you're diverting them down another path. You're diverting them into social services versus entering the criminal justice system through a citation or an arrest. Case management, or documenting our efforts to get those individuals into their services. And finally, the local code. This is the piece that we're missing. The piece that you have before you to consider is to ensure safety and enforce rule of law if necessary. You've done all of these other things. The person refuses and is content to stay under the bridge, then you have an enforcement mechanism. So you don't end up with what we had at the beginning with some of those photographs. So, last slide. 3 things to remember, and it's really the underpinning idea of this whole ordinance. It's built on the idea of educating, encouraging, and finally enforcing when all else fails. This ordinance is not about trying to replace or suggest that any of these other programs or services are not working. They are. They're working very well. But the reality is we have some people that just refuse to accept it. That's all I have. Do you have any questions?
Are there any questions, Karen or Councilman Mays?
I have one. In fact, and I've been on the council through these discussions, but not on this committee. So maybe I should know the answer to this. But when I'm looking at your slide about defining what available shelter is, it would appear to me that the rescue mission meets all of those requirements. So what is it about the dignity and respect, a bed, no cost, within the city, and no mandatory religious or therapeutic programming? I think that's true of the mission.
The shelter has additional rules that there are sometimes some situations where they will not accept a person. Whether
Correct.
If they're intoxicated or
Carry
under the
their
influence
weapons.
of drugs or weapons, or maybe they've caused a problem in the past or something like that. But the shelter does not accept everybody.
That
And-
wasn't identified on the list, and so that's why I asked.
The list is not intended to be
Okay.
exclusive. The point is you have to have an available option without restriction. Those were the restrictions that were involved in that case.
Okay.
Whatever the restriction is, would be something we would have to look at, and we would need an option that did not have those restrictions.
Okay, thank you.
Yeah.
And Karen, if I may, we've talked to a couple of various teams and, like I've said, there's been some testimony that people don't want to go live at the mission, and they were against that. And I think if I'm correct, and I didn't go through my notes, but I was trying to see, I think that's where we're kind of stuck at, where would we house them? Because we have to have that available to them when we walk upon them. But, we can't make somebody take them if they're, and Barry has rules, and he sat right in one of these meetings and says he has rules.
understand that.
And several of them said that they don't want to go over to the mission. So that's kind of a question with where we're at, and I put that down as a note. I don't know, Liz, if you got anything off the top of your head. I know you've been keeping notes, but that's kind of one of my questions is where are we at on housing? I know we had a lot of people come to the table. I don't see the, just a second, sweetie. I don't see the homeless task force here today. Corey, that's you? You're gonna be that where that at too? Okay. I don't know if you guys have kind of talked about that, because I know there's been some discussion with them. Sure. Kind of where we're at there.
So the homeless task force has kind of taken the pilot project on as a special project. And so we meet regularly to trying to discuss how to get services to the individuals that we just got on the program. So that's kind of what they're working on right now. So making sure that they have food, et cetera.
But what about the housing part of it? Have you guys discussed any of that?
Yeah, so I guess funding is the issue. We're pretty maxed out, all the agencies. There's not a lot of funding in excess of what's already in the community.
Okay, and then I want to go back to what you had said, that you guys have so much money allotted for these individuals. Is that a HUD requirement? Is that a city requirement? Whose requirement is that we just have so much available per month?
So the grant that we apply for, it's a competitive grant through the Continuum of Care, which is part of the Homeless Task Force. Our grant is for a little over 1.6 million. And so basically we divvy that out, take our admin out, divvy out through the 12 months, and that tells us how much we can spend per month, which is how we kind of budget for the year, so we don't get to the end of the year and not have enough money to pay rent.
Okay, let me ask you in a different way. Corey, we have a lot of people now in need for that. You guys have ramped up our numbers that we can't even control. Can we move some of those numbers around? How, I mean, is that set in stone, or?
It's pretty set. Right now, the only option that we might be able to discuss with maybe the Housing Authority is trying to get some people from Shelter Plus Care into public housing or the Housing Authority. But again, their situation is similar to ours, where they're pretty capped out. But if we can graduate some Shelter Plus Care folks into another housing option, that would free up beds that we could pull more people onto Shelter Plus Care.
And that would be the only option, would be Section, or Housing Authority, which
Or-
is Section 8.
Or some employment for some of the ones on Shelter Plus Care that are capable of working. There's plenty that have significant disabilities that they're unable to work, but we have some that can. So some employment opportunities for those folks might be beneficial as well. Because if they're paying more of the rent, then that frees up more money for the next person.
Okay. So does that amount change every month?
Yes, it goes, every time their income changes, they pay 30% of their income towards rent, and then we pay the difference. So if their income goes up, we pay less, and they pay a little bit more, and so that allows free money for another person.
Kind of like Section 8?
Very similar, yeah.
So we haven't had anybody on the employment side step up to the plate and said, hey, we'll help.
Have not, no.
So we need to work on that.
Yeah.
Okay, can you please make sure that's in our notes, Liz? Okay, I don't want to see you put that hat on. You got enough hats. In your task force, is there anybody there with employment, on the employment side? Can you check for me?
I will check, yeah, I'm not aware, I can't think of anybody right now, but I can check and report
Because that
back.
would be the only way we would free up money, is that correct?
Or move them off of Shelter Plus Care into Section 8 or public housing,
Okay,
where they can continue with their subsidy.
okay. And I'll talk with Corey to see, I think his name's Corey, right? Corey?
Trey.
Trey. I always call him Trey. I'll check with Trey and see what he has to offer.
We've actually asked the Housing Authority on a few occasions to prioritize homeless individuals, and it's been our goal of ours at the Homeless Task Force, but haven't been able to
Haven't been
successfully
successful?
do that yet.
I'll make a personal call to Trey
Okay, thank you.
and put that in my notes, please. Yes,
I would throw in that through the Momentum 2022 workforce group that I've been on for, I don't know, a couple years. It's shifting now, but the project I've led was to get an inventory of all the work, both the training and the workforce assistance options, so that pretty much anybody would be able to plug into the system and at least know who to ask and where to go. people have limited amount of time to all be on the task force, but as long as there's a good inventory so people can connect. That is stalled a little bit with software development over at the partnership side, but the idea is to, just so you know, come up with a list of the primary folks who are involved in workforce assistance. And then what I call the second string, which is kind of the hand-holding string. It might be a veterans group or a church group or a group down on the river. It doesn't matter. People that are helping other people get plugged into the system. So it does sound like that's one of our ways out.
We have had a few people that were along the river that actually reached out and asked for some assistance in getting employment, and Facebook is great sometimes because if we've helped a few people get some employment just by posting on that. The only problem that we have with those two particular issues was transportation. So that's another barrier, but we do have a lot of bus passes in the community, but that's not a solution for every single day, so, yeah.
Community Resource Center, in essence, gave us 10 monthly bus passes a month to
Good.
distribute. So that's helped a lot out for Wood and things like that.
Good.
All right.
Another question, and based on the conversation earlier, I know that Section 8 vouchers are portable. Are the Shelter Plus Care ones as well?
No, they are within the city limits.
Within the city, and is there any allowance to prioritize people who have documented prior residence in Topeka for those?
No,
I think you can do
that's something we can discuss. We don't have that.
I'm just listening, and I know that it can happen. It's happened with mental health for years, that we had such a good system that people would migrate to Topeka to take advantage of the services. But to a certain extent, that sort of like full employment or full housing, that pressure is not bad. It keeps people moving through the system. It pushes them into getting into alternatives. I'm thinking that a lot of the people that don't want to go to the mission don't like being close to people. They don't want to share space. And so an alternate shelter isn't going to solve that problem either. They need those vouchers. And they also need the motivation to get off the river and get something else. So that at a certain point, if we've got a good system going, that tension's not
Right.
bad. Got a comment over here.
Thank you. Go ahead, Sergeant Clem.
I just thought I'd bring up and remind one of the other options other than another shelter or a wet shelter, because one of the issues with the mission is if you're intoxicated, you can't go there.
Right.
Whereas in this ordinance, we would still have to have a bed available. So instead of a wet shelter or another shelter like you're talking about as a designated camping area that is designated somewhere within the city limits, that whether it's the city ran or an agency ran, that's just another idea that does fulfill that bed issue.
We did talk about that, and we looked at that, different areas, and I think it was an overwhelming, to me at least, overwhelming response of people taking advantage of the underserved, because like we know, okay, this is an area where they could go, they could camp, and then you have people preying on,
I do think
not the
there would be some
underserved, but
challenges.
the,
But
and yeah, but that was an option. But I
yeah,
think
my
that
only
was,
counter argument to be that there's no difference than having a designated space than what we have right now, except for, because like right now, if I wanted to go prey on this population, I would just go behind the mission because there's
Right.
a ton back there and there's nobody other than the unsheltered back there. Whereas if you have a designated space, you potentially can have, whether it's law enforcement, like you can have services there, there can be other resources there that can help cut down on that. Because like right now, you have that exact same issue when there's no oversight, there's no one there for those individuals to turn to for help. Whereas if it was a designated space, you potentially could flip that around. So just food for thought. That's all I was
yep.
mentioning.
Karen?
I was thinking that there had been some research done or some reports similar to the court cases that some cities that had tried to do that had been pretty much of a disaster. No?
There's some. I know the homeless task force went to California. It wasn't exactly in the same idea as what we were thinking, but they went and visited a camp there, and Corey actually went so she can be much more specific. And it wasn't exactly what we were thinking and what our thoughts were here, but I mean, I don't know. My personal thoughts, we already have a large camping space behind the mission. Most of that's owned by the railroad. So just theoretically, if the city bought all of that, able to mow it down and put in like a shower house, so you have a storm shelter and actually have designated camping areas. I mean, everybody's already camping back there anyway. So it's just food for thought. I just thought I'd mention it.
Okay.
Thank you. Corey? What'd you see in California, Corey? Put that hat on. You don't remember?
That was about a year ago, but let me recap. So we went to, was it Ventura? Ventura, thanks. Okay, I already forgot where I went. We went to Ventura, which is a population about the same, even though it's California and the weather is very different and California is very different. We looked at a bunch of different campsites, and when we went there, they had a very small community and basically had sheds with no air or heat in the shed. So they had little sheds all over the campsite. They did not see a decrease at all in the number of homeless that were on the streets even after the implementation of this little designated campsite. So even though they were helping a few with services at that designated campsite, they did not see a decrease at all in the number across the city. So
Okay,
it was
thank you.
very interesting.
Dr. Burton? Thank you, Corey.
To speak to what Sergeant Clem was suggesting, there's a report out called Tent City USA 2017, I believe, something like that. And in that report are examples of how communities have tried to effective ways of addressing homelessness issues and not effective ways. And they had several examples of communities that did it in an ineffective way and communities that did it in an effective way. One of those communities is in New Mexico. I can't remember the location. Their model, they had some architect, engineer students come in and lay out a campsite. And the campsite is able to house, I think, 50 people, something like that. And that campsite is set up in such a way that there's a warming shelter, a community shelter around it, and then people camp around that. And so there is a big need in our community for a warming shelter, because to speak to the lawyer's issues, there are people in our community whose ability to comply is impaired, not their willingness, their ability to comply. They can't maintain a home. They can't get into a home. We can talk about Robert or Lauren or Pat, who's and Patrick, who's these folks we don't have appropriate housing for them at all. They used to be institutionalized at one time, but we got rid of all that.
Yeah.
So there's that issue that the people that are not going to be able to comply with the ordinance, it's not that they're not willing, it's they don't have the ability to comply. And so what are you going to do with these folks when you come to implement this ordinance? They need a warming shelter. They need a place to go where they can, and this is needed desperately down there. I know Clem knows that. They need a place where they can do laundry, where they can get water, where they can cook food, where they can rest. And why? Because a lot of these folks are banned from the mission. You can get banned from the mission for weeks and months at a time. So if you put a warming shelter down on that property, and there's property that's two of those lots right down there, east of the mission, are owned by the mission, and they've talked to me about the possibility of donating those lots. There are two other lots that are owned independently, Marie Cortez and some fish factory or some fish place. You could effectively put some kind of, what runs down there now are like strongman camps, and Daniel has a camp, and then people camp around him. We made sure that Daniel had propane heat in his camp over the winter, so people could go in and stay warm when it was cold out. He distributes water. So you already have a model of basically Randy's camp is run kind of that way. You have a model of strong men on the river, and women too, when Misty was there, or Melissa was there, having people camp around them and providing them resources. They know where things are, who to talk to, what to get done. And so that might be a model that I might be willing to work for. I know I've talked to some of the homeless folks about it, but if you guys are, one compromise might be if folks down there can have some type of warming shelter, some type of community resource where we can put Sergeant Clem in there, and Vallejo can go down there, and other folks can go down there and work with them. It's not the best way to handle it, but it's already what's going on down there anyways. So you would just be improving it by providing, Daniel wants many homes run on solar power. Some of the folks got solar power stuff down there already. David had huge solar power panel down there. A lot of folks got solar power to charge their batteries and their phones and things like that. So, many homes down there are doable. You could probably put in, I don't know how many down there, and have people camp around them. I don't like the idea of camping being our answer to being homeless. That's not what our community should be providing, but maybe that would move us towards a permanent structure down there where folks could have those kind of resources available to them.
Thank you. Thank you. Did you have something to add, Missy? And then I'll ask if you guys have any more questions for Luther.
I know one of the main reasons that people won't stay at the mission is because of they are forced to do religious services, they are forced to go to church, they are forced to take classes that they don't, haven't been even, to see if they need those classes, So they're being forced to do these things and then asked to leave because they're not following through with what's supposed to be done. So they're trying to enforce religion onto people that don't see things the same way they do. And as Russell said, the mental health issue among some people, I work with a gentleman down there. I worked really hard to get him back on his Social Security disability, and he's in a state hospital right now waiting for housing because he's not one of the individuals that can take care of himself. I have a camp there, and I have 5 tents around my camp, and it's individuals that I'm trying to help, get into housing, and it frustrates me because they want help, and there's not another shelter available. So their ability to comply with this ordinance and their willingness don't even matter because they want to, they can't. So it's frustrating to see that, yes, some people can't take the services, and they would love to. So I just wanted to let you guys know that that's his 5 points that came across with, having shelter available. The reasons why they don't is because they're forced to do things that.
And that's been mentioned here before. Those are his rules, and we can't change that because those are his rules. So, but thank you for bringing that to us. Thank you.
Could I ask her a question
Sure.
while she's still there? Part of the issue is rules. At a certain point, if you're going to have a campground, you still need people to clean up their stuff. They still need to take care of themselves, at least to the point where they're not infesting the rest of the people there with bugs. They still need to use good judgment about where they take care of their personal hygiene, let's say. And people who refuse to do that still are going to get kicked out of, even by a peer group, right?
Yes.
So it sounds like you've had a lot of luck getting people to pick up.
I have. And as far as I tell people every single day, we can shower every day down there. I let people know. Part of Daniel and I, we've been working together to set ground rules, There's trash, pick it up. If it's not yours, who cares? We live here, pick it up. But there's not as much chaos as everybody thinks. We're a family. I know every single person. Well, I can't say that. Of the 70 people that I know are there, 5 of them I don't know. Every one of them, I know their name.
Right.
Every one of them I'm close to.
But I'm just trying to, at a certain point, we can't keep trying to create something, but this middle ground, if you will, of what you all are doing.
And we're working on like setting a specific spot for, if you can't go to the Mission to use the restroom, then how to do it properly without leaving a mess or behind traces of,
Whatever.
yeah.
Gotcha.
But we are working on it. And
And you can't get everybody, but it sounds like the effort that you're making is making great
a lot of
progress.
people have pitched in to help clean up and to.
Thanks.
to-
I guess that gets back to me, even in terms of looking at Luther, when you go back to the page 1, I guess, or slide number 1, when you look at the things that, it's not that anybody doesn't like homeless people, well, maybe there's some people, but hardly anybody. It's the issue that they don't want people in the right of way. They don't want people misusing property anywhere, especially close to the public. They don't want trash, all of which we have ordinances about anyway, right?
Some degree.
What you do in public and what you don't.
And I think that's a lot of why they picked the woods as well. Because it's less public. And there's still that issue about being, a public place, but it's close to, close to the Mission is the main thing. You can shower there, you
Gotcha. And somebody's gonna clean it.
can, no, they're gonna clean it.
Right, right. Thanks. Thanks, just.
Okay, do we have any more questions for Luther or Lisa, where we stand? Because we, right now, there's no way we can pass this ordinance without having housing. I think that's the issue. Lisa, do you see any other issues?
No, Councilmember Ortiz, that's the primary issue, and I think a lot of that's tied to funding. We talked a little bit about the campgrounds, that's going to be tied to funding. We had a pretty robust conversation with Ori, and I don't know who the individual was with the homeless task force, but they gave a really good presentation on it, and, there is money involved. So I think maybe if we can keep working on some folks to partner, maybe that's the best way to go about it.
Liz, if you can send us that link that we could watch that on our own, that would be great for the members of this. Luther, do you have anything else to add? I thank you for your presentation a second time.
You're welcome. I don't have anything else.
Okay. Anything else? Karen? Okay. Well, we've got a lot to chew on, and to figure it out. And does anybody else have staff have anything else they want to add before we? No? Okay. Okay, well, we got a lot to chew on before we come back. And then the Division of Code, I asked everybody to send me an email. Did you get any emails? Councilman Mays, did you get any emails from anybody that was concerned about code?
No.
Okay. And I know me and Karen kind of talked about it, and we did and didn't, where we wanted to start. First, I wanted to ask, I'll ask Sasha, I see her back there. Sasha, I know that city manager had talked about he wanted to do the, help me out here.
RPI, Rapid
RPI.
Process Improvement.
Yeah,
Yes,
has he
ma'am.
done anything with that yet? Do you know?
We've done one RPI event on our abatement process.
Okay,
I believe, correct me if I'm wrong, we use sanitation abatement to go through that event, and then the plan is to take those efficiencies and push them down to the rest of the abatements that we do as they are applicable.
okay. If it's all right with the committee, I would like to, what I don't want to happen is, I asked him and he never got back with me, but that's okay. Since they've already done that, the RPI where they go through and see, I wanted to kind of mirror that, hand in hand, as opposed to us saying, okay, let's do something totally different, then they'd have to research that when they're probably going to research it anyway. So if it's all right with the committee if we just use that abatement as the next one, and we'll start there with what you guys already have.
Sure, we could bring you the presentation from that
If that
RPI
would be
event if
okay.
you'd like.
Sure.
And then I can also provide to you the other 2 items that we suggested from code enforcement to go through RPI.
Okay.
They haven't yet been prioritized because there were so many departments and so many projects, but we can do that.
Okay, and that way they would already have that information, if that's okay? Yes,
Lisa, Lisa's waving a hand too.
yeah.
Councilmember, I think if memory serves me correct, isn't the first presentation on that, did you give that already, Mike?
That was in April.
Mike did.
That was the April one, so you have 2 more that are coming up down the road? Nothing scheduled yet, okay.
May
No,
7th.
no, we talked about it, am I correct, Mike? We talked about it, and I told the city manager when we said we were gonna start getting into code, I didn't want them to have to do another research when they had this, and we could start there behind that RPI process. You've never given anything to my knowledge, right?
So Mike presented in April on that abatement process to the
Right.
council. But other than that, no ma'am, you guys have not seen anything else from the processes that we intend to do the RPI on for code. That,
Okay, Karen?
I did send you an email, but we haven't had time to go over it. I guess I do think, based on how much this comes up, that the RPI has to do with a process that we've already agreed to do and doing it smarter and faster, in a sense. I think we need to back up. If we're going to really tackle public input on code, we need to start, they're the implementers, we're the policy people, we're the ones who are supposedly setting up the code to say this is what we're going to enforce, this is what's important in Topeka. And I think we need to, whenever we start as a body here, first say, well, what are the goals? What are we trying to do with
Okay.
code? And staff has done some work on that too, so engaging them not necessarily to do anything that they haven't done before, it would depend, but I think you've done some prioritizing. But to get our signals straight on what we're doing, once you get into anything, it's not just code, then there's the issue of policy, and then there's issues of administration. Anything from how does somebody read the words, what's the interpretation of what that meant, policymakers versus how it ends up on the street getting enforced. There's also just what the procedures are. There are issues of partnerships, be that from department to department or working, like we just talked about with community-based agencies. And then there's success measures. How do we measure whether we're being successful at what we wanted to do? And I'll just throw out an example. In the case of code, it would be that we have less cases rather than more at a certain point. Our people are working their tails off. Where are we going with that? And so there are all kinds of steps and evaluation points in between. But if we had our overall goals, so that then when we pick, whether it's abatement, if abatement comes first, that's fine, or cars, various places, or securing the outside of structures, or we could probably take the code, because people have so many thoughts about it, and divide it into about 30 conversations or conversation topics. But I think our discussion needs to be structured on an agreed view of why we're doing this.
Well, the reason why I said let's use the RPI is because they're going to show us how they do it, and correct me if I'm wrong, this is my understanding, how they do it, what process they would like to change, and I don't understand or what process they want to cut out or implement or put in. And I thought at that particular time, that's when we can go in and say, why are we doing this? Why are we not doing this? This is where we want to be, blah, blah, blah. But I think we're going to have to be real specific at abatement, or, just narrow all those down so that when people come, that they will understand why they're coming, because not everybody's going to agree with other areas. So that's why I wanted to start there, if we can, and come back and we'll start there and then figure out where we want to go from there where the RPI is going from there.
And we can work it however you want. My thought was that if you've got an overall reason that you're doing code in an overall way you want to see it work out, where you're going with it, then that would apply to everything, and it would be a little more effective to clarify that before we start on the subject by subject, because we don't want to
Okay.
be making it up having that discussion every time we
Well,
talk about
I thought-
something.
If you want to do that, I know where I want to go with it. I didn't know you wanted to outline that, but we could, if that's agreeable, we could. I don't have a problem with that. So, do we want to come back at our next meeting and do that?
I think so.
Okay? Would that be okay with you?
Sure, that's fine.
Okay, so we'll come back and we'll say, we want to know where we're going, or, is that right, Karen? Or
Why
what
are
our,
we
what our mission, I mean, what?
Exactly. What
our-
outcomes are we trying to get? Why are we
Okay.
doing this? So
Okay.
what? Why are we doing code
I mean, because
compliance?
I will agree to do that, but I just want to go case by case to see blah, 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 blah. I understand where you're going, because I think things have changed from when I got on here in 2005. We did not. We had one going out for housing, one going out for nuisance. I think now we are cross-trained, right, Mike? And somebody tell me we are, I'm gonna scream. But we didn't do that, so I know where I want to go with that. I want to make sure that we're cross-trained, and you've heard me say that several times. I do want to go with the educational piece. I think that's very, very important. I will continue to say that, when I have weeds in our ditches and they're saying, no, that's the city's fault, and I'm saying, no, that's back to you,
Well, that's why I want us to put that kind of thing out front first, because I agree with you.
But
Just want to
I-
make sure we're not at,
But I just want to make sure that if they're going through a process, I don't want to send them back through the process. I guess that's what I'm trying to say. I want to make sure that we kind of stick together. I'm not saying that they can't do that if that's the way that we direct them, but if we don't have to, to me, that's a waste of time. So if we can start at abatement, that would be great, because there's areas that I'm going to probably forget where that are even there until they come up. So, Sasha, if you can kind of give me a rundown, would that help us? To give me a rundown of all the areas, the different areas, because there might be areas that I don't even know about.
So that, thank you for letting me speak. I have a couple of questions to be sure that I understand. When you're talking about rundown, Madam Chair, you mean of our different types of cases and the processes that go along with that, is that correct?
I want to know abatement, I want to know
housing,
housing, I want to know
vehicle,
nuisance.
yes.
I want to know demolition. I
Yes.
want to know,
Got it.
what else are people screaming about? Property. I just called Mike about some property that my neighbor quit cutting, said he's did it for 30-some years.
Right.
He's tired of it.
The passed away owner, yes
Yeah.
ma'am. I'm
What else can you
familiar.
think of, Karen? Or you jump in here too, Councilman Mays. I want to know everything, and then maybe that will help us, give us a little guide to see where we're going.
I think everything that you mentioned and that you did, the issues of like warrants and access, yes or no, the issues of opening and closing cases on the same property, and are there ways?
That will come with each individual.
And at some point, maybe at the end of the line, but as I tried to make sure I'd thought it through, the issue of historic preservation and mothballing, which we don't really have in our ordinance right now, and whether we should have some language for that kind of thing. But the more immediate things that we're dealing with every day, I certainly would do first.
So,
And Mike, if you can, and I'm not
No.
excluding you, Sasha, but if you can look at all the complaints that we get, like the cars on the lawn, the loud music, what else is out there? Anything that you want to add, okay? Feel free to do that. Because those are I think I know what I'm trying to do, I'll speak for myself. We get these continuous calls, and we want to make sure that we understand them. Does that make sense? So that we can get a better feel. why do you guys have more cases? I mean, you know,
'Cause we're doing a
maybe we'll
better
give
job.
Karen more work to do, get her out there, code compliant.
Well, you
Maybe I need to ride with code compliance one day. Oh, Jesus. Corey, tell him, I gotta be with you, Corey, yes.
Thanks. So I think, I mean, based on our discussions previously, I mean, I don't think the issues with your department are not unlike any other where it's really a lack of resources. You know, I mean, I'm sure more could be done and they just don't have the money, the funding to do it. And so I guess part of my thinking is, you know, how can we find a way to have the violators pay for the enforcement rather than, you know, the non-violators, which, you know, paying everything out of the general fund. I can't imagine that it's cheap for you guys to, you know, send out notices and, you know, send a person out and do an investigation on a property or something. I mean, there's got to be some kind of a processing fee or something like that we could implement at some point, or?
So we do charge administration fees
Okay.
on certain types of activity that we do in the community, as well as a direct charge for cleaning up your property. That's a billed by the hour. But if I may, Madam Chair, just to kind of expand what you're saying, not only are what we're faced with in this community challenged by resources within the Department of Property Maintenance. So if Mike had more inspectors and Corinne had more prosecutors and court had more judges, yes, we would have more productivity, more case totals. But on the flip side of that, I would remind you respectfully that many of the people that we are dealing with in the community don't have the financial resources to fix the issues that we are perpetually citing them for. Layer on top of that mental health issues, and we have chronic violators that maybe have hoarding issues.
Yeah.
So my point is that yes, it's a shortage of resources inside the house, but then outside the house, right? And to Councilmember Hiller's comment earlier about a reduction in cases, in a best case scenario, yes, ma'am, we would be able to reduce cases. But given the current environment and the number of people that in the community that we know own homes that they can't afford, can't physically, aren't able, whatever the issue is, they're not being maintained. I don't foresee a dramatic drop in cases. And when we dig into that, Madam Chair, we can talk about the things that we are seeing dramatic drops in, like the number of landlords probably that Mike and the prosecution office have to deal with. Those numbers are going down. The numbers of structures in the community that need to be demolished because they're dangerous, those are going down. In fact, now we're finding that we've gotten all the low-hanging fruit, and now it's a real battle to get some of these houses brought down. But like I shared with you the other night, the good news of that story is that owners are now rehabbing those houses and putting them back into productive use. So it's such a complex environment in Topeka, and probably no different than any other urban old place, right? That I don't know if we can ever, in my lifetime working with the city of Topeka, dramatically reduce those cases, but we are seeing reductions because of the increased productivity, the partnerships between prosecution and the inspectors, property maintenance unit, in terms of education and really tightening up our processes so that when it gets to court, if we have to prosecute, it's all good to go. So we can for sure outline all of those improvements, and so I'm clear, you want kind of a high-level overview of what each one of those cases looks like. We'll try to highlight the improvements that we've made internally since the adoption of the IPMC, and then really key has been our relationship with the prosecutor's office and having a really close
And I think
knit.
if we bring that back, then we as council members can say what we want to tackle first and go there. I know, I think that would be good to go through everyone. I've always wanted to do it too, Karen. There's different cities that do different things, and that would give us a chance to dig into doing some of that. And I say that because I know several of the firefighters, just like in this town, they burn them down when they need to be demolished. It's a lot cheaper. But then I've spoken to some of the chiefs and higher up, and they're saying, well, we have to be careful because we got this, that, or the other, you know. But they're saying, you know, if we were to burn it, it would be cheaper and we could get more done if you get to that point. Because and the training that goes along to, you know, the firefighters. So I'm just saying if it needs to get there, and then I look at if we go through and see what we need, you know, Topeka's a giving city, and if we say, hey, this is what we need, da 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 da, maybe we could get more resources that way, you know, and that's kind of what I'm looking at, because I do hear from a lot of the elderly that can't, you know. I remember this lady had a Winnebago. Her husband died. She didn't know where the key was. She got cited for it. Do you remember that, Mike, over there on Taft? She called me. She's like, I got 3 days to get rid of it. Do you remember this story?
Kind of.
So I called the firefighters. I said, you got 3 days to get this thing out of this lady's thing. And they went over there and grabbed it, and they moved it. She didn't know where the key was. It was broke down. She didn't know any of that. And guess what we did? Took it out, took it to the salvage yard, and they gave her little money, and she was happy. She was out of violation. You know, it's just things like that that we see that happens all the time.
Moral of the story, get a problem, call Sylvia.
No, that's not it. That's not it. I know for a fact that Councilman Henderson, that's all I know him by anymore, Emerson, I have seen that guy take his truck and go through Highcrest and pick up stuff that people are getting violations for. And I told him, Mike, or not, Tony, you can't do that all the time. We're just not. And now I found myself trying to do the same thing. I mean, sometimes I think if that need was out there, and I know that's not your job, I'm just saying, you know, but that's what we come across all the time is those little old people.
But I do think you're right, and that I didn't mention it as I was rattling through what we need to cover, but community initiatives, you know, partnerships include what we can do interdepartmentally, in my view, or with regular partners out in the community that can do this or that or the other thing. But if we need to get from here to here or establish a new, I mean, we have, sometimes it's just, you keep talking about education and you're right, sometimes it's just shared information. And we, the people in Chesney and Central Park have had the trash pickup near the Expo Center forever. They volunteers monitor it, and they help get tons of stuff off. You know, we've got a guy in Tennessee town who picked up tires for years and then had to kind of thread his way through changes of regulations to get permission to continue doing that, and those kinds of things make a difference. So,
Make everybody own it. We have a huge Washburn football team that said, what can we do? We're here to serve on behalf of our fallen brother. And when I started listing stuff to them, they wanted to meet with me, and I said, no, I'm gonna give you a list right now. Mentor youth, come out and you cut grass, you know, da 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 you know, but why we have them?
Yes, ma'am. Monique has had a meeting with the athletic staff from
I told them to go around and mark all.
Similar, here's a list.
Yeah, I told them
Let
to
us
go
know
around
what
and
you
mark
want.
all the lights that are out in that area. And they were like, "Do what? Yeah, we need that too. We need to report that for you guys. The overgrown trees. We could put so many teams together to help you." And Sergeant Clan does his homework. We could have him help us too. You know, so I just think there's so many, and one of the things that I'm working on is to get 501 kids. I think they're the only ones that don't have to do community service to graduate. So I'm going to talk to Dr. Anderson to see if we can put that in place and get Mike some little people. Yeah, strong little people. So I think it's everybody's. I want staff to know we want to work with you. We're not working against you, but we need to understand it. And some things I don't think we understand. And I think that's when we could educate, you know, the public, when they send us that email and say, blah, 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 blah. So, anything else? We're good? We're good?
I do think this is going to take us a while. As I was thinking about it, I thought, you know, it's already going to be July by the time we start. And realistically, taking this on, we talked about meeting monthly and doing it. It could be that,
Same time next month, Liz, set it up if you can.
but
Is this a good time for you?
Probably.
Would, do you prefer?
Yeah, it worked out today, but
No, I'm just, she'll get with you. But
Okay.
if we can do that, Liz, put us on the book for July, okay?
But we may need to even envision that this would, just so we aren't trying to tackle too many topics at once, because each one of these has its whole family of
That's
i-
why
examples
I
and
want to
issues.
do,
But I'm thinking that this could easily be a 15-month, something that would carry through next year for the committee to just be methodical and not rush it,
we'll see where we get.
so.
Okay? You got that, Liz? But does 3 to 5 work for you?
yeah, typically.
Okay, okay. And she'll check. I kind of like it, so I can kind of go home. All right. Anything else? If not, this concludes our meeting. Thank you.